Hello all, I am Dr. Walter from SNS College of Physiotherapy. So today we are going to see a new concept of the physiotherapy. Okay. So you might have seen in the past month about n number of videos regarding the neuro, biomechanics and A to Z of any type of exercises, modalities like that we have seen. And this month we are going to see about the myth of the physiotherapy. Actually, that was a myth about many things. You may know, like a myth of a symmetry, a myth of a tanker lorry, a myth of any type of lorries, or any type of sumo vehicles. Yes, if we see an omnivan, we might think like this omnivan is a kidnapping vehicle. So that is called the myth. So like that, for our profession also, we are having certain myth. So I have chosen a 5 major myth that is disturbing the upcoming people. So we are going to render this myth. It is not a myth, and we are going to crack it down in this video. Hope this video will be helpful in this session. Now, what is the myth of the physiotherapy in the first case? It is mentioned that it is only for the old people. Okay, actually, if we are going for a physiotherapy center or in a hospital inbuilt physiotherapy OPD department, we can see not only the old people, we can see young men, young women, even the children's, that is the pediatric cases. Yes, physiotherapy deals with from pediatrics to geriatrics, from childhood to the old age, and in between of the ages also. Physiotherapy concentrates most on the recovery of the patient from any type of diseases. So this myth is cracking down here that physiotherapy helps in the pediatric cases if the patient is or the child is suffering with the hydrocephalus or a cerebral palsy or autism. In geriatric cases, the patient suffering with Parkinsonism, falls, or n number of stroke conditions. In between, we can see the cervical pain, the lumbar pain, sciatic pain. In these types of cases also, physiotherapy works very well. Okay, so we are cracking down the first myth here, and we are going for the second myth, that is, it is painful. Oh, like we can see physiotherapy will be painful in many videos. Yes, you might have seen in the Instagrams and YouTubes that chiropractors are doing the breaking of the bones and joints like that. No, it is not like that. Physiotherapy is a rhythmic passive movement process associated with the electrotherapeutic effects also. And this physiotherapy is not painful, but it gives a harmonial effect with the rhythmic pattern of exercises and the rhythmic pattern of treatment for the upcoming generation. We are cracking down the second point here, that it is not painful, but it is a rhythmic process which will be liked by the even the pediatric cases to the geriatric cases. Going for the third one, that is, it is only for the injury, otherwise going for the after surgery. We are going to break this here. As you are know, we know that this third point is not suiting here, as we treat the patients for injury and after surgery with correction, postural correction, ergonomics, which is blooming in the IT sector. In nowadays, each and every IT sector has a physiotherapist to take care of their staffs in the ergonomical approach. We are cracking down this third point here, that it is not only for the surgery, not only for the injury, but the postural correction, ergonomics are blooming out in the physiotherapy field. Fourth point is only about the exercises. No. As physiotherapists, you might have heard many myths. They are massage therapists and a number of things. Never. As we are belonging to the physiotherapy, this exercise, electrotherapy, and n number of neuro development therapy, craniosacral therapy, and many more therapies have been associated in the physiotherapy. Not only the exercise, but the technique which we are applying on the patient, that the patients are getting released by the years and years of pain. We are cracking down this fourth point here, that it is not only about the exercises, it is about the treatment and the technique patterns which we are adapting in the modern lifestyle. Going for the last and final point, that is the session is only one is enough for the whole of a 10 years or 20 years or 5 years of pain. No. This is based on the body type. If a patient is having acute pain for 1 or 2 days, maybe a one session or two session is enough. The patient is having a chronic pain, chronic cervical pain, he cannot able to turn his head like this. For one session, it is not so enough, but based on the body type and the ergonomical and the positive approach of the physiotherapist, we can clear that 10 years of pain and the chronic pain within days. So this is about the breaking points of the 5 myths which I have chosen, and hope you have understood that physiotherapy plays a vital role in day-to-day life in each and every person. Thank you.